Welcome to the Heath News vlog with another interesting video about a silent killer bacteria. A flesh-eating bacteria is on the rise, and the oceans are to blame. Imagine a tiny scratch on your skin turning into a fight for your life. A small cut that invites a silent killer, one that eats away at flesh, spreads rapidly, and leaves doctors racing against time. Across America's coastal waters, a new threat is emerging: flesh-eating bacteria. And scientists say climate change is giving it the perfect breeding ground. The human story just outside New Orleans. Fisherman Leonard Lyons prepared crab traps for his grandchildren, something he had done thousands of times before. But this time, a small scratch on his leg nearly cost him everything. Within hours, he was feverish and vomiting. By the next day, black sores spread across his leg. Doctors rushed him into surgery. He was given just a 50-50 chance of survival. This wasn't just an infection, it was Vibrio vulnificus, a flesh-eating bacteria that attacks the tissue beneath your skin. Lyons survived, but only after weeks in the hospital, multiple surgeries, and antibiotics. His case is one of many, an alarming sign of a deadly trend. The science of flesh-eating bacteria Vibrio vulnificus thrives in warm, brackish coastal waters, where fresh water mixes with the sea. For decades, infections were mostly limited to the Gulf Coast, but now scientists warn the bacteria is expanding northward, fueled by rising sea surface temperatures. Between 1988 and 2018, infections along the East Coast increased by 800%, according to the CDC. The bacteria that once lived in Louisiana's bayous and Florida's shores are now being reported as far north as New Jersey and even New York. Why? Because climate change is reshaping the oceans. Warmer waters mean longer survival for Vibrio. More intense storms and flooding bring seawater into inland communities, creating new pathways for infection. The bacteria can invade the body in two terrifying ways: through open cuts or wounds exposed to seawater. Even a paper-thin scratch is enough for it to enter. By eating contaminated seafood, especially raw oysters, which can carry Vibrio. Once inside, the infection can escalate rapidly, causing necrotizing fasciitis, a condition that destroys skin, fat, and muscle tissue. Without immediate treatment, the infection can lead to amputations or death. Doctors warn that people with weakened immune systems, liver disease, or diabetes face the greatest risks. But as Vibrio spreads to new areas, the general public is more exposed than ever before. Climate change isn't just about rising sea levels or stronger hurricanes. It's also about hidden health threats. Warmer oceans are turning into breeding grounds for deadly microbes. Researchers now link the increase in Vibrio cases directly to rising global temperatures. Every summer, as coastal waters heat up, the risk surges. The season for infections is longer, the geographic range is wider, and the bacteria are more resilient. This is why scientists describe Vibrio as a climate-sensitive pathogen. Its rise is a warning of what's to come. Diseases once thought confined to certain regions are now breaking borders. For survivors like Lyons, recovery is long and painful. Even after beating the infection, he describes his life as misery. He still faces surgeries, skin grafts, and months of rehabilitation. Others are not as lucky. The CDC reports that Vibrio vulnificus kills about 1 in 5 people it infects, often within just 48 hours of symptoms appearing. That's why health officials stress the importance of awareness. Imagine walking barefoot on the beach with a small cut on your foot, or eating raw seafood at a summer festival. What once felt harmless is now a risk factor for a deadly infection. What you can do so? How do you protect yourself? Experts recommend avoid swimming in brackish or salt water if you have open cuts, wounds, or fresh tattoos. Cover injuries with waterproof bandages if contact with seawater is unavoidable. Be cautious with seafood, especially raw oysters, which can carry the bacteria. Seek immediate medical help if you notice redness, swelling, black sores, fever, or vomiting after water or seafood exposure. The rise of flesh-eating bacteria isn't just a medical issue, it's a climate issue. And as our planet warms, the line between natural beauty and hidden danger continues to blur. As we dive deeper into the growing concerns around flesh-eating bacteria, one chilling fact stands out. These bacteria are not new. They've existed for centuries, but climate change has given them an alarming advantage. Warmer oceans and rising global temperatures create the perfect breeding ground. Scientists warn that Vibrio vulnificus, one of the most dangerous strains, thrives in salty, brackish waters when the temperature exceeds 68 degrees. And here's the unsettling part. Coastal waters are staying warmer for longer periods every year, expanding the regions at risk. Let's put this into perspective. Just 20 years ago, most Vibrio infections in the U.S. were confined to the Gulf Coast. Today, cases are emerging in states like New Jersey, Delaware, and even as far north as Connecticut. Experts estimate that cases have increased by eightfold since the late 1990s. If warming trends continue, flesh-eating bacteria could expand their reach into areas once considered too cold to sustain them. But how exactly do these bacteria become so deadly? Once they enter the human body, often through an open wound or by consuming raw shellfish, they spread rapidly, releasing toxins that destroy soft tissue and cut off blood supply. Within hours, what looks like a simple wound can turn black, blistered and life-threatening. The U.S. Centers for Disease Control and Prevention reports that about 1 in 5 infected people die, sometimes within just 24 to 48 hours of symptoms appearing. This is why scientists stress urgent awareness. Rising sea levels and flooding caused by climate change are not just about property loss, they're about exposure. Each flood mixes seawater with urban runoff, sewage, and industrial waste, creating conditions where Vibrio and other pathogens multiply. People wading through floodwaters after hurricanes like Katrina or Ian face hidden dangers that can turn deadly in a matter of hours. Globally, the picture is no less frightening. In Asia, particularly in countries like Bangladesh and India, flooding events linked to monsoon intensification are raising Vibrio infection rates. Meanwhile, Northern Europe is now witnessing outbreaks in the Baltic Sea, a region once considered too cold for such bacteria. Climate change has not only shifted the geography of risk, but has also intensified the frequency of outbreaks. Now, let's connect the dots. Scientists say this is not just a health issue, it's an environmental justice issue. Vulnerable communities, particularly in coastal and low-income areas, face the highest exposure. Limited healthcare access means higher fatality rates. Without preventive measures and education, the number of cases will only continue to climb. But there's another layer to the story: seafood safety. Vibrio bacteria are also found in raw shellfish, especially oysters. As warming seas accelerate Vibrio growth, foodborne infections become more common. Health agencies have already recorded outbreaks traced back to contaminated oysters harvested from previously safe waters. This means that climate change is quietly transforming not just our coastlines, but also our food supply. And the economic cost is staggering. Treating necrotizing fasciitis often requires multiple surgeries, intensive care, and sometimes amputations. For survivors, the medical bills can reach hundreds of thousands of dollars, not to mention lifelong trauma. For industries like fisheries and tourism, outbreaks erode public trust, discourage travel, and disrupt livelihoods. What we're seeing is a chain reaction. Climate change heats our waters, bacteria thrive, humans get exposed, and entire economies feel the shockwaves. So what can be done? Scientists are urging investment in surveillance systems that can predict and monitor outbreaks based on ocean temperatures. Public health departments need more resources to educate communities, warn seafood consumers, and prepare hospitals for fast response treatment. On an individual level, experts recommend simple but powerful precautions. Avoid swimming with open cuts, wash wounds thoroughly after ocean contact, and be cautious with raw shellfish consumption. The message is clear. This is not a distant, future problem. It's here now and accelerating. Flesh-eating bacteria are a stark reminder that climate change isn't just about melting ice caps or hotter summers. It's about invisible killers thriving in our warming environment. And the clock is ticking.